The information contained on this platform represents the opinion of the host and shall not be understood, construed as, or a substitute for medical or health advice. Please see a health professional who is aware of the facts and circumstances of your individual situation.
What's good, 365ers? My name is Britt Daniels, your co-host of Black Health 365, your fit life coach, yogi, and serial entrepreneur. Y'all know how it goes down here. It is our mission to be champions of truth and change by providing y'all with personalized healthcare information and resources from trusted professionals. We are here to empower the Black community to make healthier choices all year long. And I'm joined by my beautiful co-host.
Yes, personal trainer, radio personality, Jackie Page. Britt, how are you doing today?
Jackie, we'll hop right in it. I am tired. We are back at it. We are outside. Work is upon us. So we in game mode today. Today, personally, actually, is like a 16-hour day for me. It's been a long day between
What
running
you been doing?
multiple clients, setting up different contracts with corporations.
You popping in these streets.
You know how we do it, Jackie. We stay busy. I do try to stack my days like that so I have other rest days, but it's just one of those crucible type of days where you get through it. I am a serial I like to check things off. I like to check things off.
I understand that.
We getting through it today. With that being said, I am grateful for the opportunities I've been presented. One word that I came into this year with was two words, actually. One was scaling. How can I scale to touch more lives? And two, receive. How can I receive more spiritually, physically, mentally? So it's been an interesting year, to say the least. What about you?
I ain't gonna hold you. I'm tired too. Baby, the last week has just been a lot. When I tell you, like, event after event. So 365ers, I'm a radio personality in Atlanta, but when I tell you it's like event after event, meeting after meeting, I'm literally like, what day is it? And I said that on air today. I was like, I said, like, I'm like, is this Wednesday? Is it Tuesday? Like, I legitimately didn't know what day it was. And I'm sure somebody in the car got a good laugh out of that. But I was being real, like, I didn't know what day it was. And I'm still trying to figure out exactly what day it is. But hey, it'll be like that sometime. But no, when you say like tired, like completely tired. And it does not make it any better that, I mean, they not like super bad, but like my allergies are kind of like trickling a little bit. So that's just like making me extra tired. And I want to take something, but then I don't want to take something because if I take something that I may be, and I understand there's the non-drowsy kind. However, that drowsy kind that you take, it just hit a little different. So all that being said, I'm trying not to take anything because I'm trying to, like, stay alert. But baby, when I tell you just like it's a gambit of things right now, I'm like, make it stop. Like you said, very grateful for everything, but I am in a space of just like, yo, I need a nap.
I hear you, Jackie. That sounds like overwhelming, to say the least. And that's definitely a word that has been following me for the last couple weeks since I've been back from my spiritual sabbatical in Japan. And actually every single, previous podcast we've been talking about allergies. I had allergies for like 15 days.
Yeah.
And yeah, a lot of people been having issues, Jackie, from my clients to family members. And it seems like some people are getting them at different times. So it's really weird. What have your allergies been like?
So I've suffered with allergies all of my life. They used to be really ghetto in DC, like ghetto. They haven't been as bad here in Atlanta, but every so often they kind of pick back up and decide like, I'm gonna rear my ugly face. So I kind of feel like it's a slight like, let me just remind you, you got allergies. So they haven't been super bad, but they here. And it's like, why is my eye itching and why am I for no reason? Like, make it make sense.
I understand. That kind of like gets us to our Dharma talk today. There's so many things out of our control. And today's Dharma talk, or our 365ers, we'd like to start our conversations off with these small sermons to set the tone for the conversation. Today, we are talking about allergies and going to get into the science of it. Going to have a great, very intelligent guest today to talk about what allergies are and what symptoms can be and how you can navigate it. But getting to this concept, allergies, a lot of times they're out of our control. A lot of things in life are out of our control. So as people, it's often that we try to apply control over so many aspects of our life, from our thoughts to our emotions to people to situations around us. However, the truth is there are things that are simply not within our control. And when we try to control everything, we create stress, anxiety, we become attached to certain outcomes and become disappointed and maybe even frustrated when things don't go our way, don't go as planned. This attachment to control can cause us to miss out on the beauty of the now life, prevent us from experiencing new and unexpected opportunities. I come from a Buddhist tradition, and in the Buddhist tradition, there's this concept of letting go. It's essential. It involves releasing our attachment to desires and outcomes and accepting the present moment as it is. And by letting go, you can cultivate that sense of peace and equanimity, even in the face of uncertainty and change, right? So yeah, letting go allows us to cultivate this trust in ourselves and I guess the universe. Let God, let him do it, right? When you let go, you realize you don't have to have all the answers. You deal with life where it's at. Life shows up where it's at. So yeah, with that being said, allergies again aren't something that's many times in our control. They can honestly seem mysterious,
Baby.
So it's
in
yeah.
more ways than 4. Okay.
This is an interesting conversation. Just looking at some information from the Asthma and Allergy Foundation of America. It is May is National Asthma and Allergy Awareness Month, but just let's be real, allergies affect people all year
All
long.
year long. Doesn't matter when. Even in the winter, which is kind of crazy because, well, I deal with a lot of like the seasonal allergies that still kind of affect me all year long. But anywho, it's really crazy that it is like something that, bothers people all year long. But, to your point, yes, May is asthma and allergy, awareness month, but it is something that people deal with all year long,
What's
unfortunately.
I think a lot of people, when it comes to allergens, we think of just springtime, pollen,
Hmm.
as you just mentioned, and what I assumed I was dealing with for like 2.5 weeks. But allergens come in many forms, right? We also think of pet allergens we get from pet fur.
Food.
Food, yeah, which is a big one. Like I think my brother, he had a peanut and a shellfish allergy growing up, so he had to be very careful what he ate. And those are like the scariest to me because I like to eat. I'm glad I don't have any food allergies. Well, actually, I had one. I was allergic to chocolate when I was a kid. Not anymore.
No. Oh my
Why?
gosh. That is actually one of my fears that I will, and this actually happens to people where they develop an allergy to like food as they get older. That's one of my, because I love to eat. That's actually one of my fears that I may hit an age, eat something, and I can't eat it no more because I didn't developed an allergy to it. Like that's a legit fear.
Ain't that
That's
something,
a
man? I
legit
feel
fear.
like it's a glitch in our system. I feel like a video game character, and like something just goes straight. Like what? I'm just living my life, eating everything I want to eat, and then one day I can't eat this no more. Like what's going on in my body?
Yeah, it's like what it's it kind of goes back to the science of our bodies. I think a lot of times we forget that our body, is a machine and it kind of does whatever it wants to do. And there's a lot of science that goes into our body. And it's something that we forget. So it's a great reminder that your body is kind of like a machine. It is, there's science in this thing. So
Yeah.
it will change and change is going to come.
Yeah, I'm very excited to speak with our guests, and this is Black Health 365. So, we're talking about the Black community here, and so I'm just interested. Obviously everyone has allergies, and clearly Black people too. But it seems that from research coming from the asthma um, online community for asthma and allergies, some research I've done, Black Americans are more likely to be diagnosed with asthma compared to white Americans. Why is that? 2 times as likely to have a hospital stay due to asthma, 3 times as likely to die from asthma, 5 times as likely to visit the emergency department due to asthma. So I'm interested in speaking with our guests and understanding what are some of these deeper roots. And I'll leave it there for you to introduce.
Yes. So without further ado, I have Dr. Bridgette L. Jones, who holds a faculty appointment as Professor of Pediatrics at the University of Missouri, Kansas City School of Medicine. She is a clinical scientist with a focus in therapeutics and interventions to improve the lives of children with asthma. Dr. Jones, how are you doing today?
I'm doing good. I'm doing pretty good.
We
I
are
was
really
tired before I got on, but you guys have given me some energy.
well, thank you. Really excited to have you on. I think both me and Britt share the same sentiments. We deal with allergies and have dealt with allergies all of our lives, and the questions are real. Do you have allergies?
I actually don't. Isn't that weird?
It is.
I don't. Knock on wood, knock on something. I don't have any allergies right now.
I mean, because yeah, as we get older, things do change. So you may not have them today and may have them tomorrow. But I think I want to start with a very like elementary question. What exactly is an allergen?
So an allergen could really be anything. So an allergen is something that your body develops an immune response to, and a specific type of immune response. So where your body makes an antibody called IgE, and then that IgE binds to cells in your body called mast cells that break open when you are exposed to that allergen and releases things like histamine that causes you to itch and sneeze and have hives and have runny nose. So there are multiple things that can elicit that type of response that we call allergens. So things like pollens, things like mold, pet dander, so cat and dog dander, but also things like foods can elicit that IgE response. Sometimes different medications that we take can elicit that IgE response. So pretty much anything could elicit that theoretically, but it seems like there's certain classes of different proteins that one can be exposed to that typically causes an allergic response.
With that being said, as organisms, are allergies genetic? Where do they come from? Why do we have allergens? It feels like a defect for our existence.
Yeah, so there's likely a genetic component to allergies. So we know that allergies can be passed down. So if your parents have allergies, then you're more likely to have allergies, or you're more likely to pass that on to your child if you have allergic conditions like what we call allergic rhinitis or runny nose with allergies. Or if you have asthma, you're more likely to pass that down. We don't know of a one specific gene that turns allergies off or on. So what we think is there's probably a combination of things that have to happen. So you probably have to have some genetic component, some genetic predisposition. And then on top of that, you probably have to have some type of exposure at a certain time. So it could be being exposed to allergens at a certain time, but there's also things that happen in our body when we're exposed to things like viruses. So we know that viruses, being exposed to viruses, certain viruses when you're a young child, are a big cause of developing asthma, which is a type of an allergic condition. So there's probably several different factors that kind of have to come into play for you to develop certain types of allergies.
But so you said like there are certain viruses that kids can get as they're growing up that develops or brings about asthma. Is that the same for adults? Because I know of people who I have friends who all their life never had asthma and then all of a sudden got older and boom, here it is.
Yeah, so typically you typically aren't diagnosed with asthma as an adult. Usually you have some symptoms as a kid, whether it was truly diagnosed or not, but maybe as a kid you coughed a lot when you got a cold, and maybe no one really picked up on that kind of consistent pattern. And as you get older, we do know, especially with women, as you get older with different hormonal changes, can cause exacerbations or increased symptoms of asthma. So maybe it wasn't recognized as much when you were a younger child, and when other things started to happen in your body that caused your symptoms to be a little bit more pronounced. And then you eventually got a formal diagnosis of asthma because your symptoms were more persistent.
That is so crazy. I'm just
Yeah.
the
So there's lots of factors. That's the thing that makes it really, complex, of us kind of figuring out what exactly causes it, and then figuring out, what are the specific treatments for these different conditions. They're very, heterogeneous. They're all very different, from having asthma to having allergic rhinitis to having eczema or skin conditions that are related to allergies. They're all very different. And there's lots of different drivers of those.
In so many aspects of health, we talk about preventative measures. Going back to our Dharma talk, lack of control. Is there anything preventative you can do?
Not that we really know of at this point. Like I said, it seems to have to be this combination of maybe a genetic predisposition with being exposed to a virus at a certain time. What we did learn, observed in COVID, was that masking seemed to help, and we'll have to continue to follow the data. But I just saw a study today that showed kind of the association between babies getting certain viruses or not and developing asthma as they got older. And so,
Wow.
Not being exposed to those certain viruses at a certain age may help prevent asthma. So things like masking, what we saw in COVID was there was much less, the rates of asthma were much less during COVID when kids were home, or when they were out, they were masked, they weren't getting as many viruses, and their asthma control was much better during that time.
That's an interesting comparative study. I'm just thinking about, I used to live in Japan, and even before COVID, everyone wore masks.
Yeah.
And I'm just wondering,
Yeah.
like, from a comparative study on a global scale, does that population deal with less allergens due to
because they
that?
have on a mask all the time.
Right.
Yeah.
That's interesting.
Yeah. I don't know that data specifically, but you think about less exposure to viruses, but also less exposure to pollutants, which we also know drives things like asthma and allergic disease. So theoretically, if you're thinking about prevention, masking at certain times may help prevent exposure to things we know drive allergic disease.
So speaking of prevention, and this may be a crazy wild question, but I have allergies. I don't have any kids. Is there anything that I can do now to ensure that, if I do have an offspring, that my child doesn't have to deal with allergies? Because they are the absolute worst, and I don't want anybody else to have to deal with what I go through.
Yeah, it probably not. There's probably not anything that you can really do to control that. Like I said, genetics is probably a small component of it, but it's all these other factors that are, living kind of a normal life where you go out and you interact with people. There's probably not a lot that you can control about that, unless you decide to live in a bubble or try to go somewhere where there's no allergens in the air. It's probably going to be difficult to avoid. But it doesn't, just because you have allergies doesn't necessarily mean that your kids will 100% have allergies.
I hate to
It
say I feel
varies.
like they just may, but they just may, because my dad has allergies, and I'm 99.99999% sure I got them from him.
Yeah. So it's passed down. Yeah.
That makes it, going back to our earlier statement, this makes allergies feel so mystical to me. Like, we don't know. You say it's genetically passed. It can be genetically passed on, but we can't identify the gene where the
No, there's
allergies.
probably not one specific gene.
Mhm.
Yeah. So and also the way that your genes work is there's some genes that are what we call, kind of describe as turned on or turned off at different times. And there's different things that turn them on and turn them off. So viral exposures can turn on or turn off genes. Pollution can turn on or turn them off. And things like chronic stress, toxic stress, we're learning now that can turn on or turn off different genes. So it's even not as simple as, you have this specific gene. It's which ones are kind of turned on and turned off at certain times and how they're all interacting with one another.
For me, this really just emphasizes how amazing the human body is. Life is in general, just how, like, just this product of us being here. There's so many different processes happening, even as I'm talking right now. That's crazy. Well, extending the conversation of genetics, is there data to suggest that certain ethnicities, certain groups of people are more prone to their certain allergies more than others? If that makes sense.
So not from a genetic basis. So, when we talk about genetics and race and ethnicity, we have to recognize that race and ethnicity are social constructs. They're not biological at all. They're made up definitions that have been used to categorize people and put people in groups, but they really have no biological significance at all. But what is linked with race and ethnicity are social drivers that people are more likely to be exposed to based on their race. So, for African American or for Black people, they may more likely be exposed to things like pollutants because of things like redlining that occurred in cities where there's highways beside Black neighborhoods. So you're more likely to be exposed to more pollution. You may be more likely to be exposed to certain viruses just because of the workforce and what jobs may be available to certain groups. Like I mentioned before, things like chronic stress and toxic stress. We're learning a lot more about how chronic stress and toxic stress, and specifically stress from racism, are impacting Black people and leading to kind of turning off and turning on these genes that may lead to more allergies or asthma risk. And so it's not tied to your genetics relative to race. It's more so tied to the social factors that you may be more likely to be exposed to because of this racial categorization that we've come up with, to determine opportunity, determine kind of what job you have, determine, what your day-to-day life is going to be like.
Speaking of exposure, I kind of want to get personal here and talk about some of the allergies that I deal with, and maybe I can get some clarity on my own personal life. So I know for sure. So I've never had an allergy test, so let's start there. So a lot of this is off of assumption. But I know for sure cat dander sends me every single time. And I want to say like grass and the cherry blossoms in DC takes me out of here. I used to live in DC. I live in Atlanta now. I don't understand. I'm from North Carolina. I don't understand why my allergies were worse in DC and in North Carolina, and they're not as worse here.
Yeah.
What is that about?
Yeah, so it's probably the specific allergens vary from region to region. So in certain parts of the country, there are certain tree pollens that are more prevalent in the air than others. So here in Kansas City, we tend to see a lot of juniper pollen, a lot of oak pollen, where in Arkansas, from where I'm from, there's a lot of pine pollen. And so depending on where you live, you're exposed to different pollens, different molds, and things like that. And so I don't know how long you've been in Atlanta. You may not have been in Atlanta long enough to develop allergies to those things that are in the air yet. So with time, you could, maybe you may not, but you could develop sensitivity to those allergens over time. So it usually takes, around 3 or 4 seasons to start to develop sensitivity to different allergens. And so it just may be a matter of time.
Dr. Jones, I'm laughing, trying not to cry because I'm like,
But
oh, I'm
it may
good.
not happen, it may not
I'm like,
happen.
I'm good. You like, actually, sis, pipe down because they may be coming. But that is good to know because that's something I've always wondered. I felt like as I've moved, I've seen like, different levels of my allergies. Sometimes they're great, sometimes they're not so great. So far, Atlanta has been pretty okay. When I lived in Richmond, Virginia was pretty okay. But DC, and I grew up in North Carolina. North Carolina has always been worse and for me. Like I can go from one state and come to North Carolina and it'll be fall. And I'm like, I can't breathe. Like my eyes are watering and burning. So that's just something I was always very interested in. Speaking of, kind of just staying on the topic of exposure, um, how is it that you can ingest the food and be perfectly fine, touch the food and have an allergic reaction, or vice versa? Like you can ingest it, but you can touch it. Like, what is that exposure situation about?
So usually, if you have a true food allergy, what we would call an IgE mediated food allergy, usually ingestion is going to be the main way that elicits an allergic response because you have to you have to get enough in your system to cause that immune response. So usually just touching a food won't cause a true allergic reaction. You might get like in kids that have food allergies, when they eat, they get messy. And so sometimes just touching the food on their skin can cause redness there. And so that's typically not considered an allergic reaction. But if they eat the food and they start to have coughing or wheezing and develop hives, that's considered an allergic reaction. And so just because you may get a little bit of redness when you touch a food, there's irritants that are in foods as well. So there's additives and preservatives that irritate our skin sometimes. And that doesn't necessarily mean that you're allergic to that food.
To get a true idea of what you are and what you're allergic to, is it important or is it really necessary to have an allergy test? I feel like over the years, I keep telling myself, oh, I'm going to get tested and, see what I'm allergic to. But I just feel like it's the same it's the same things year after year. Like, is it really necessary for me to do that?
I think it's helpful, if your allergies are very significant during a certain time of year or they're bothering you all year round, I think it's helpful to know exactly what those allergens are in the environment, because you can know when those allergens are in the air. So usually the news reports give the pollen counts. And so you can find out, okay, on this day, today, the pollen count is really, really high. So I should maybe limit my exposure outdoors or keep my windows shut in my house or in my car, or make sure when I come home to take a shower and change clothes, make sure you're taking your allergy medicines. You have your allergy medicines on board. So it helps you kind of plan to try to avoid your allergies, and also to make sure that you have treatments on board. If there's things that are identified that are in your home that are allergens, so pet dander, but also there's things like dust mites, there's cockroach allergens, where you can do things about that in your home to limit those exposures. So, I think it depends on the quality of life impact. If your symptoms are having a significant quality of life impact on you, testing is often helpful.
Yeah, I often think about, for people who have kids, recommending that it would seem important to get an allergy test for your kids, because you don't want that scary situation where they eat something and you have to find out the hard way.
Yeah, I would caution against getting kind of blind testing, especially for foods. For food allergy testing, it should be very specific to what you're suspicious of, what you've possibly had a reaction to, because the food allergy testing is not as accurate. It has what we call a high false positive rate. So we really want to test for things that we're suspicious of and not do like big panels of multiple foods, because lots of things will come back positive.
Oh, that's interesting. So maybe I wasn't allergic to chocolate when I was a kid.
If you didn't have a reaction to chocolate, if you were just tested to chocolate and it was positive and you never had a reaction to it when you ate it.
Not to my knowledge, not to my I was told, and I just never ate chocolate. And to this day, I don't eat chocolate.
Really?
But I can eat chocolate, and I have, but I just go out of my way to not eat chocolate.
I don't want to encourage you to eat chocolate, but I feel like you should just try it just to see.
Okay.
Chocolate allergy is rare. I've had one patient.
My parents lied to me.
Or maybe you should go see an allergist just to confirm, but
that's a really interesting. I wonder how many parents actually do that to keep their kids from eating certain things. Like, oh, you're allergic to this, so you can't have it. It looks like it worked for you, Britt.
We're not giving y'all ideas. Don't lie to your kids about that.
Dr. Jones, what are some ways to treat allergies? I know you just mentioned taking your allergy medicine. I've also heard that you can do the local honey as a method of treating allergies. So, just kind of wanted to ask you that, what are some of the different, outside of, what we know, like the generic, going to go get medicines, are there other things that we can do to treat allergies?
Yeah. So like I mentioned before, avoidance if you can. So knowing kind of the pollen counts, limiting outdoor exposures, if there's things that are indoors, environmental controls to get those out of the way. The medical treatments are things like antihistamines, nasal steroids. You can use antihistamine eye drops, but also there's immunotherapy or allergy shots that we can do. That's typically for patients that have been on medications and medications have failed and they're still having significant quality of life impacts. And so there's shots that are given that actually have some of the allergen in them, and it kind of desensitizes your immune system over time to where your immune system no longer recognizes that allergen. And then there's also sublingual allergen drops now that are available that are FDA approved, that are for single allergens. We only have them available now for ragweed pollen and one tree pollen. But they're just drops that you can put underneath your tongue and use those at home instead of shots where you typically have to come into a doctor's office. There are, a few studies out there that show that, the local pollen may work in some ways similar to kind of allergy shots because, the bees gather the pollen and that's how they make the honey. So it probably has a little bit of the allergen content in it. And over time, the idea is it may help desensitize you. But it's not a studied method where we have clear data that it's really effective.
We've been talking a lot about allergens, but we actually haven't talked about the symptoms, I believe, completely. What are some symptoms that you may be having an allergic reaction to something? Of course, we know pollen, you may get stuffy nose and disgusting mucus and stuff, but what are some other symptoms, a wide range of symptoms that one can experience?
Yeah, so if you're having an allergic reaction, so that's different than just like nasal allergies. An allergic reaction is typically a pretty fast onset after you've been exposed to an allergen. So whether it's a food or whether it's a medication or a drug, so it usually happens within half an hour or so of being exposed. Most common symptom from that type of reaction are hives. So like a raised, red, itchy, kind of welt type rash. And so that typically occurs pretty quickly. And then you can start to have other symptoms like coughing, kind of like an asthma cough, wheezing, runny nose, just itching in general. And then also vomiting and diarrhea can happen with very severe allergic reactions, or what we call anaphylaxis. And so anaphylaxis is when you have more than two body systems involved. So you could have hives and wheezing. So that's called anaphylaxis, and that's a severe allergic reaction that you probably need to call 911 for. If you have injectable epinephrine at home, you can treat yourself, then call 911.
It's interesting to hear you say that because all this is just this is a lot for me right now. It's crazy to hear because I don't know, when I think about my allergies, I just think about me and what I deal with. But Britt deals with something different when he deals with his allergies, and the next person deals with something different. It's just so interesting to hear that there's so many different types of allergies and different responses to it, which I'm sure, as you said, just makes it really hard to kind of like find like a general cure for it all, because it's just so many different kinds. Do they transform? This again may be a very like, Jackie, what type of question is this? But can allergies, I don't know, like mutate?
Well, you can gain more allergies, like I talked about, as you get older, or different allergies. Typically allergies don't go away unless you do something like allergy shots or immunotherapy, but you could gain more allergies from things that are environment, but there also are certain foods that you can develop later on in life, food allergies that can come later on in life. Most food allergies are diagnosed in early childhood. So most food allergies are diagnosed by the time a child is school age. But there are some food allergens that for some reason that we don't completely understand that you could develop later on in life. So things like shellfish allergies, fish allergies, and there's also meat allergies that can be developed pretty much at any stage as well.
I know I said this to Britt earlier, but that is a fear of mine, to develop a food allergy, because I love fish. I love shellfish and I love meat. So for you to say like, oh, you got an allergy and you can't eat this anymore, it would send me. I would cry.
Yeah, those are really hard ones, for adults. To been able to eat this food all your life, and then all of a sudden you have an allergy to it.
Yeah.
Doctor, I've learned so much in this conversation, and still at the same time, allergies still remain this mysterious thing to me. Um, Two questions: what made you get into this field? What led you to this field? And two, what would you define the role of allergists?
Yeah, so the thing that drew me into the field was mainly asthma and treating asthma. So, I started out in pediatrics. I did a resident in general pediatrics. And in that, I saw a lot of patients with asthma, in particular, a lot of Black children with asthma that was uncontrolled. And so it gave me a lot of satisfaction to be able to help those families and help those children kind of come up with regimens that work for them. And so that's really what pulled me into the field. And then, as we talk today, it's very complex. So it's actually really interesting field, and there's a lot that we don't know about it. And so there's a lot of science that's left to be understood. And so that's just really intriguing for me.
Yeah, I can imagine. Because this is it's a lot that gets into the whole allergy thing, which we clearly have gotten into some today. Dr. Jones, thank you so much for coming on and just, shedding some light on allergies. I know there's so much more that we could talk about. Because again, this is just like a really big, big thing that affects a lot of people. If people want to reach out to you, if they want to contact you to, talk a little bit more maybe about their allergies or the asthma that they may be dealing with, where can they do that at?
Yeah, so I'm on Twitter at BLJ08 is my Twitter handle. And then I can be reached through the Children's Mercy website. So Children's Mercy in Kansas City.
So 365ers, if you have allergies, if you are struggling, Dr. Jones could be a great resource. And speaking of resource, do you have any suggestions of resources that the 365ers can kind of tap into when it comes to asthma and allergies?
Yeah, so the American Academy of Allergy Immunology has a great website that has patient-facing information that's really helpful. I think you already mentioned the Allergy and Asthma Foundation website as well. For pediatrics, especially for food allergies, the American Academy of Pediatrics has a lot of great information. And then the National Medical Association, which is the Black Physicians Medical Association, has an allergy immunology section. So that's another great place to go to for information.
Dr. Jones, thank you so much. Definitely appreciate it. 365ers, we got to leave you with what's your 365. And today, show empathy because you don't know what people are going through. I think one of the things that we realized in this conversation is that, allergies is something that a lot of people deal with. You may not know it, and it affects everybody differently. Like I know with me, I get the itchy, runny nose. Sometimes the dry mouth, itchy, watery eyes. Like it could be for some people a debilitating thing, and you may not know it. So, show empathy because again, you never know what somebody is going through. So be a little empathetic today, tomorrow, and the rest of the week. 365ers, as always, if you want to reach out to me, Britt, you got anything that you want us to cover or talk about, hit us up on Instagram, slide in them DMs. Black Health 365, Black Health 365. That is the handle. You can find me at Love Jackie Page.
And you can find me at profitfitness.life. Remember, 365ers, it is your responsibility to be an advocate for your health. Peace and namaste and love.